where we come and cover you for the loans insurance. Basically, every life policy, last expense and all. CIC asset is where now we do investments like money markets. And then there's CIC general, where now the medical and all fall there. And let's say for all office assets, WIBA policies, motor insurance, those ones fall under now CIC general. So we are a composite insurance firm, and we take care of all your insurance need under one house. More specifically today, we are going to talk about medical cover that we were advised that the Sacco is in need of. And this medical cover is what we call CIC Coop Care. And CIC Coop Care is, I would say, before we got these products on board, we had had, of course, a lot of feedback from you in the cooperatives movement. You had mentioned that the conventional medical comprehensive insurance is very expensive, especially for those who are in the Juakali sector, those who are in entrepreneurship, and those people who don't rely on their employers to get a medical cover. So we came on board with a product that can suit those people who are not able to afford the normal comprehensive insurance covers for medical. And the reason why Coop Care was born, because we realized that the normal comprehensive insurance cover for medical can be very costly. And you realize that some people are low income earners and they're not able to afford the insurance in totality. So they only rely on NHIF. Coop Care was born from a place of affordability and just giving access to medical in a very affordable manner, and making everyone be able to access medical services without having to strain families and forming groups to be able to raise small amounts of money. We are looking at a very micro cover in nature, and basically it's a cover that you're looking at a situation whereby it's either you have just an NHIF card only and you don't have any other cover. Other than that, if you already have an existing cover with your employer, it can just be an additional cover, because you can never, you're not restricted to only have one medical cover. You can always have one on the side. If you exhaust this one, you can use this other one. That is the reason why Coop Care was born. So basically, it's a customized medical solution for the cooperatives movement. So if you're not a member of any society, you're not able to benefit from Coop Care. That's the catch with Coop Care as a medical cover. So just to dive in, when we came up with Coop Care, we had a target audience. Our target audience is members of the cooperative societies and circles like Telepost members. You are our direct audience for Coop Care cover. And for eligibility, a member must be between 18 to 70 years at the point of entry to this cover. You'll realize that the normal medical cover, when you hit 60, they tell you your age is no longer eligible for normal medical insurance. So Coop Care, we came up with a cover that you can extend it up to 70 years at the point of entry, meaning once you hit 71, we'll not be able to take you on board. But if you already, if you're getting to 71 and you're already on cover, then we'll continue with cover for yourselves. So we can cover you either as an individual or you and your families. So you can decide, I can only afford for myself alone. There is that option, or I can afford for me and my family. There's also that option. So that is our target audience. In terms of our value proposition, this is what are we giving you in terms of this cover? What are we selling to you? Number one, we are selling affordability. The premiums are very affordable because we give you a low-cost provider panel. We have mission hospitals, we have low-cost private hospitals. We'll be able to share the same with you. Once we are done with the presentation, we'll share through your office, and I'm sure it will be shared to all members. We have a panel of providers that is cutting across countrywide, and you don't have to worry about when you're in up country, will you be able to access a hospital around you? Yes, we've put all that into consideration. So you're on cover. you can always access your medical cover from anywhere in the country. It's a simple product in nature, comprehensive for all medical needs. You'll understand what we mean by all medical needs. It also has higher benefits depending on your need, and there's benefits for you as a member and also your dependents. In terms of flexibility, it's very easy to enroll. One, we have a web portal on our website where you can enroll online, or we can also give you the physical proposal forms. So basically, just a minute, sorry. If you're a digital person, you can always go to the website and access the same. Another flexibility is the fact that it's a group advantage. As long as you're a member of a Telepost Sacco, you are able to access these products. For example, if you are someone who is out there, you're not a member of any society, forget Telepost, you're not a member of any Sacco, you're not eligible to get Coop Care as a product. So let me give you like a brief of the product overview. In terms of scope is how far the cover can go. So we have inpatient, we have maternity, outpatient, dental, and optical. I'm very sure these are familiar terms. And then in terms of our panel, we have faith-based missionary hospitals. We have affordable, private, and then we also have government hospitals. Once we share the panel with you, you'll be able to see such hospitals. You'll find St. Mary's, you'll find Kikuyu Mission, you'll find Bliss, you'll find Equity Afia. Those are just but a few that you see around you. And then in terms of controls, we have something called copay, which you'll be able to understand. Copay is the amount that you pay before you access even the admission services, or rather just normal services when you get into a hospital. There's a waiting period. This is the period whereby you have to wait before you access a medical cover. And then there's sub-limits you'll see under inpatient and also outpatient. And then we also have a provider panel, the one I said that cuts across the entire country. So these are some of the details about Coop Care. For us to enroll Telepost Sacco, because here is the deal. If we are bringing you on board on Coop Care, you will all fall under Telepost Sacco. You do not come to us as an individual. If you come to us as Alice, we cannot take you. You must be a member of a Sacco. You have to be affiliated with a society. Through that affiliation is when we give you the cover. So for startup, for us to open a Telepost account on our end at CIC, we will need 4 members at least. 4 members must join the medical scheme. Then now we open an account for Telepost. Then the rest can now join subsequently. So they can be joining, sometimes people are like, hey, me, I don't want fast. But then when you realize this thing is good, then now you want to join. Maybe you are taking your time, you want to think about it a month or two. Some people don't need to think, they've already joined because they know the benefits. Then they'll join fast. Then the members now can be able to join. So what we'll do now, we will be prorating as they join, because now the cover has to run for 1 year for each person. So we will just prorate so that we also know when the renewal comes, we will renew everyone at the same time. As I mentioned, in terms of age, maximum joining age is 70 years. And I remember minimum was 18 years. And the options you realize was inpatient, outpatient, dental, optical, and maternity. So in terms of limits, this one I'll show it clearly in a table, you'll see. In terms of limits, we have inpatient of between 100,000 to 300,000, outpatient of between 30,000 to 50,000. We have maternity of between 20 to 30. Then we have dental and optical of between 5,000 to 7,000. We also extend COVID-19 of 100,000 to 200,000. And then we also have a select panel for the product. Like I'd mentioned, the panel of providers. When we say panel of providers, we just mean the list of hospitals that you can access, basically. In terms of premiums, because this is where usually the rubber meets the the ground properly, because this is where now decisions are made. This is where you decide, do I really need this or not? Or how much am I able to afford in terms of cover limits? So as you're looking at this screen, you'll see something called premium rates. Premium rates are just the amount of money that you'll pay us to be able to access the medical services. So you can see here, there's one table for all benefits, and then there's one for inpatient only. I'll guide you. If you look at table 1, I would love for you to be keen on this one. We have 3 plans for Coop Care. There's 100,000, there's 200,000, and there's 300,000 in terms of inpatient. So if you look at option 1, if you're getting an inpatient of 100,000 and outpatient of 30,000, as a member only, you'll pay 7,500 per year for those benefits that I've mentioned for option 1. If you're a member plus 6 dependents, you will pay 26,700 for still option 1. If there's any extra child, you'll pay 3,600. Meaning this extra is plus, if you go, you as a member, plus 6 of your people. 6, I mean 1 spouse and children. So 6 people, that is spouse and 5 other children. So if you have another child after the 5, then you can have an extra 3,600 so that we onboard that child as well. Option 2, the inpatient is 200,000, the outpatient is 40,000, and the premium for a member as an individual is 8,500. A member plus 6 dependents is 31,600. And an extra child again, 4,100. You realize the premium goes up as the benefit also goes up. Then we have option 3. Option 3, where your inpatient is going to be 300,000 and your outpatient is going to be 50,000. As a member, you'll pay 9,500 per year. All these premiums are yearly. You pay one-off, or the Sacco can pay on your behalf and they deduct for you subsequently over a few months, depending on the arrangement with you and the society. Yeah, so as I was saying, option 3, 300,000 inpatient, 50,000 outpatient. Member alone, 9,500. Member plus 6 dependents. Alice, kindly mute. Yeah. Member plus 6 dependents is 36,000 for the benefit in option 3. And then any extra child, 4,600. So when I look at this, we are looking at all benefits. I'm looking at optical, not really. I'm not looking at optical. I'm looking at inpatient and outpatient in totality, meaning you're getting both and paying these premiums. Okay, now we go to inpatient only. For any medical cover, you can never take outpatient only, but you can take inpatient alone. Meaning you can decide, I don't need the outpatient because I can take care of the day-to-day drugs here and there, admission, consultations and all that. But then when it comes to inpatient, you feel like that is where you have a need. You decide, me personally as so-and-so, I only want to be covered on inpatient only, you're allowed. So for option 1, inpatient, for a member alone is 2,500. A member plus 6 dependents, 7,300, and 1,100 for an extra child. Remember, this is only inpatient, no outpatient. For option 2, for an inpatient of 200,000 only, as a member, you pay 3,200 per year. If you and your family M plus 6, you pay 10,800 and an extra child 1,400. And for option 3, which is 300,000 inpatient, for a member only, you pay 3,800. A member plus 6 dependents, 12,700, and any extra 1,700. So when you look at the two tables, you'll realize there's a table for inpatient only, and there's the other table for the inpatient and outpatient. So like I mentioned, you can take inpatient only, but you cannot take outpatient only. Because some people usually come and ask us, can you just quote for me outpatient? No, you cannot take outpatient alone, but you can take inpatient and outpatient. When it comes to inpatient, you can take it by itself without an outpatient. That is something that needs to come out very clear. So in terms of waiting periods, when I talked about waiting periods, I said it's the period and the amount of time that you have to wait to be able to access medical services. So in terms of waiting period, there is no waiting period for any accident-related admissions. Let's say you are outside, you are driving, or you are in a matatu, or you are in a motorbike accident, there's no waiting period. There's no waiting period for acute illnesses, those ones that develop just suddenly, like asthma, pneumonia, broken bone, and outpatient services. There's no waiting period. Anytime you feel sick, you have a cold, just rush in, no waiting period. There's 1 year for pre-existing conditions and chronic illnesses. This is like cancer. There's someone who is living with diabetes. There's someone who is living with hypertension. Those are what we call chronic conditions. They are conditions that usually they don't have a cure or medication, but they are managed over time. So those are conditions that we categorize under chronic. So these ones you give us up to 1 year for you to access the services because you already have a pre-existing. However, if let's say you are on cover and you are newly diagnosed, you've just been diagnosed while you're already on cover, we treat it as a new diagnosis. So it's no longer pre-existing. Pre-existing is a condition you already have prior to you getting on board on cover, meaning you've been treating it for a while, you've always had it, it's going on, you've been managing it. That's what we call pre-existing. But if you're really newly diagnosed, that's not pre-existing. So there's no waiting period for newly diagnosed conditions. For maternity-related treatment, there's a 10 months waiting period, meaning you cannot wait to conceive. Then you start looking for an insurance cover. You have to have it prior to conception, because if you come when you're already pregnant, then the 10 months waiting period will not even allow you to access cover when you're ready to use the cover. In terms of eligibility, children from birth, full term, to 18 years are covered. The children that fall between 21 years to 25 years, you have to give us proof of dependence to the parents. And the proof we usually require is maybe there's an admission letter, they're in school, they're in college, they're still learning. That's why they're depending on their parents. So it's very important to have a letter from any institution showing that, or even a student ID, anything that is showing that this child is still depending on their parents. For principal members and spouse, like we mentioned, eligibility is up to 70 years. So that is between 18 to 70 years. In terms of geographical limit, this means how far can this cover you? Even when you go abroad, can it cover you? No. This cover, because of the nature, because of the micro nature of this cover, it can only be taken care of in Kenya. Because even if you were to go abroad, surely it cannot be able to cover you. So the geographical limit for this cover, because it's micro in nature, is only Kenya. Copay, I'd mentioned copay. For any outpatient visit, you'll pay 100 shillings. The reason why usually there's something called copay is because it helps you be able to manage your cover, so that it doesn't mean when you just have a small cold, it's not so bad. You just go and make dawa, drink, and see how it goes. Unless it's serious, you don't really have to go and utilize your cover, because maybe there could be a more serious need in future. For admission cases, that is inpatient, for those who do not have NHIF, I believe as a member of Telepost, you all have NHIF. I want to believe so. But for those who do not have NHIF, when you go for admission, there'll always be a copay of 500 shillings. Those who have, there'll be no copay. And then in terms of panel, don't go to a hospital that is near you and it's not on our panel and just say, this is the hospital that was near me, or this is the one that I'm used to. With this cover, because of the way it's already micro in nature, if it was the other medical covers that are usually more advanced or maybe covers a wider scope, then you can go outside the panel, then you'll be reimbursed. But with Coop Care, there's no reimbursement. You have to be strictly within the designated panel of our providers. So this is the summary of the cover. We have inpatient, we have outpatient, we have maternity, we have dental, optical, and then we have the last expense. So last expense is the 50,000. These are the options I had already mentioned to you. As you can see, option 1 down to 3, you can see the distribution. Like I mentioned, inpatient between 100 to 300 and outpatient between 30 to 50. So if you're told you're taking option 3, the way it is, that is what you're going to have as a benefit. If you're taking option 2, the way it looks, those are your limits for cover. And same to option 1. So this is a family benefit. That is something that needs to come out very clearly. That's why it's indicated family, 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 family. Unless you come only by yourself, the way I'd mentioned. If you are alone, then you enjoy the benefit, all of them by yourself. If it's you and your family, you can still enjoy, depending on the option you pick and the type of cover that you pick. Benefit summary. Usually we go to, for example, here, we are looking at first emergency cesarean. You can only access up to 30,000. When it comes to pre-existing conditions, up to 50% of the inpatient cover limit, and then newly diagnosed to be covered up to the full limit. So if, for example, your inpatient is 300,000, you've just been diagnosed, you can access the entire 300,000. But if you already have a pre-existing condition, like I'd mentioned, the chronic illnesses, you can only access up to 50,000. For congenital and prematurity conditions, it's 50,000 per family. Then we have accommodation stroke bed. It is the net of NHIF because it's general ward. So whatever NHIF leaves, that is what now insurance covers. In terms of psychiatry, 20% of the overall inpatient cover is what goes to psychiatry. Non-accidental dental surgery is 30% of the overall inpatient cover. Non-accidental ophthalmological surgery is 30,000. Maybe there is something that needs to be done to your dental or your eyes. Ophthalmological is the eyes. Then you can only access up to 30,000 of that inpatient that you chose. In terms of vaccines, we have KP vaccines. I know you know KP is those ones for the government. I know the ladies in the house will understand. There's something called lodger fees. Lodger fees is if you are as a parent, your child is admitted at the hospital and the child needs parental care or needs the parents to be there with them throughout the time they are admitted, like they stay there with them. So we only pay for the people who have kids 12 years and below. So if your child is above 12 years, then they don't need you to stay over with them overnight at the hospital. But below 12 years, we will still pay for you staying with them. Road evacuation leading to admission. Maybe you need the services of the ambulance. This one is covered within inpatient. So if you look at COVID, like I'd mentioned, I know right now most people feel like COVID is a gone case, but we still have a few cases. So COVID is covered up to full inpatient for option 1. Option 1, you remember, was the one for 100,000. Covered up to 150,000 for option 2. Option 2 was 200,000. And it's also covered up to 200,000 for option 3, which was 300,000. So for outpatient treatment, you can only access the tests which are capped at 6,000 for COVID. Let's say you need a COVID test, we can only pay up to 6,000. This is also a very important part where you need to understand what is not covered. You know, the way people usually say insurance, they tell us this, then they change when there's a claim. That doesn't happen when you actually understand your cover and you understand some of the exclusions. Exclusions are those things that are not covered. They are not captured, they are not covered under your medical cover. Cosmetic surgery, unless you're in an accident and you need a cosmetic surgery, but if you're just a normal person and you feel like they need to look better, it's not covered. Weight management is not covered. People who go do hazardous sports, it's not covered. When you want to do scaling, crowns, you know, all those things you want to do to your teeth, because it's just for cosmetic purpose, they're not covered. Nutritional supplements are not covered unless prescribed as part of the medical treatment. And usually we do pre-authorization for this just to ascertain it's a prescription for your medical treatment. We have drunkenness, war, and civil commotion. We've been seeing these the demonstrations that have been going on. Usually it's a personal initiative to go and riot, strike, and cause civil commotion and all that. Usually when that happens, it's an exclusion. It's just that most people sometimes they don't want to say the truth. They were actually demonstrating and all that, but it's not. It's under an exclusion. Any expense that you've already recovered under any other insurance, and by any other insurance, I mean, maybe NHIF has already covered it. Don't expect your insurance to cover it again. That's double insurance, and that doesn't happen. We have group personal accident and WIBA. If there's any medical part of group personal accident and WIBA that has already been paid by insurance, your medical cover cannot pay it again because already the same insurance has already covered it. Beauty treatments, external surgical appliances, unless benefit has been provided for. We have optical exclusions like plano, photochromatic lenses, anti-glare coatings. If you use glasses, you'd understand these terms. So those are also not covered under this. And then bills incurred by doctors or hospitals outside the Coop Care panel. Like I had mentioned, you have to stick to our panel because of the micro nature of this cover. And then pandemics and epidemic occurrences. But in this case, the only pandemic that has been covered is COVID. So usually pandemics are an exclusion even in the conventional comprehensive medical covers. But COVID was, when COVID hit, we had to extend a cover for that as well. How do we onboard when it comes to Coop Care? What's the onboarding process? Like I'd mentioned, there are two ways. You can either go through our website, which most SACCOs don't do as we speak. They prefer filling in forms. You know, people like filling in forms where they see. And then, of course, there'll be a contact person who will be able to take you through the process. Once we have your data, we will just upload, and then we will put you under your entity if it's Telepost Sacco, and then we will issue you with cards. But nowadays, we have gone cardless, and you'll realize that Smart as a provider, if for those people who already have medical covers, you already know that Smart stopped producing cards, and nowadays you just use the OTP, your member number, and then the OTP. So there'll be a contact person. There'll be the monthly enrollment model, whereby after we take the first 4, like I'd mentioned, we open the account. So every month we will be assuming some members are still joining. So there'll be the monthly enrollment. We generate it on our end. And then we are the ones who create the accounts for you. In terms of customer service, relationship management, there'll be somebody attached to you. In this case, I'm your relationship manager, but there'll also be some client relationship officers at the medical side of our company who will be attached to you, and they'll be able to help you. So let's say you're in the hospital, you're waiting for a pre-authorization, you can always call our call center. If our call center is not maybe someone is, you know how call centers are, sometimes maybe someone is not picking or the numbers are busy, you can always call the client relations, you can always call me if now you've looked for both of them and you don't find any help. We have a service providers defined panel and the care management that I'm talking about, whereby they'll be able to help you do the follow-ups, daily and monthly admission reports, everything that you need in terms of aftercare services. So in terms of our contacts, these are contacts that are very, very, very important. For anyone who has a medical cover, you'll appreciate that usually when you have these numbers and you're stuck at the hospital, maybe the hospital is telling you we can't see your name in the system and you have a cover. Maybe they're telling you your card is not working, or your OTP, or whatever it is the situation you are in, or maybe your admission process is taking long, they're telling you you're waiting for insurance to authorize. All those things that happen at the hospital that you may need us to come in, these numbers are very important. And even that email is the one that the hospital always writes to, so that we respond through. So in terms of Coop Care, I would say that's basically how the cover works. It's a very simple but comprehensive cover. And let me repeat, I'm sure usually people ask, why are the limits so low for some people? But I can assure you, we already have a normal, conventional, comprehensive medical cover, which most cooperators had already sent complaints saying that some of their members, especially those who have an open bond, they're not able to afford that kind of medical cover because of the nature of the premiums. They're really high. So why not come up with something that even the normal mwananchi who is a low income earner, or somebody who cannot afford the other medical services, can afford at least something apart from your NHIF. At least you have something you can say, I'll supplement. I have NHIF, but I also have this. Even if it's 300,000, it will buffer you from going out there to ask people for that 300,000. So before you say Coop Care is limited in terms of scope, in terms of the limits are low, just remember there's somebody who only has an HIF card, and that is the reason why your management called upon us, so that we can come here today and just give you an easier option for those who would need this. It is not mandatory, but they saw the need for their members to have a medical cover that they can at least also just say they have a cover and enjoy certain benefits that they wouldn't ordinarily enjoy under NHIF. So thank you so much. That's my small presentation, Alice, to your members, and I will welcome a few questions here. Thank you.
Wow, thank you so much, Brenda. That was so much simple to understand. And we really appreciate for your partnership with us, offering us such a wonderful product, which is very affordable as we've listened. And I'm so glad with our members, because I can see we already have more questions on our chats. Maybe we can start from there.
Okay.
As we continue to the questions, we have our director Rispa asking that you talked about term babies. What about the preterm?
So to answer that, thank you for that question. I think it's a very, very good question and important.
Sure.
Usually preterm babies requires a lot of care. You see the way even insurance we cap age, we can say we go eligibility is up to 70 because we know the risk that comes after 70. Yeah. So even with the preterm babies, there's a lot of care that comes into play, and maybe this cover may not be sufficient for that kind of care. Most of the time you'll find they are in the ICU or they need special care until they grow and get to that point where they can be taken home. So it's just not covered because of the risks and the fact that it needs a high level of care. Yeah.
Thank you. I hope, Madam Rispa, you are answered. And even as we move to Ken, I know you came in late. You're asking about the charges. I don't know if you'll be able to repeat the whole thing. I guess I'll be able to share this after, so that at least we can be able to
Yes,
get
yes. I'll still share it with you. Yeah.
Yeah, sure. Then someone else is asking about where your office is. Maybe you
Yeah.
can be able to tell them that this is it can be done even whenever someone is.
Yeah. Our offices are at Upper Hill. That is the headquarters, but we also have a branch in town for those who are in Nairobi. Also,
You have another
countrywide,
branch in Nakuru. Yeah.
we have 25 branches countrywide.
Okay, sure. I hope
So in every
this is
major town, you will find us. Yes. So you can always walk into any branch, but you make sure if you walk into a branch, at least you make sure you notify me in HQ
Sure.
so that they are captured correctly under Telepost Sacco.
Sure.
Yeah.
Yeah, someone else, Ken, is asking, is it a must to be formally employed or just a member?
You just need to be a member, basically. By virtue of having that member number of
Yeah,
Telepost,
sure.
as a Telepost Sacco member, you're eligible just by that virtue.
Yeah. Then
Yeah.
someone also was talking about charges. We'll be able to share on charges. Amunga Ned is talking about the optical cover is a bit low for us who use specs can understand 5,000 can hardly get you a good pair. What can you say about that, Brent?
Trust me, personally, I use glasses. I wish I was in a place where I could even show you, but I'm having my meeting. I had a patient at the hospital, so I'm having my meeting in a very unconventional setup. Sorry.
Yeah,
But I
sure.
also understand that optical, maybe that will only help you with your lenses, not even the frames. So I understand that. But that's why I kept insisting that Coop Care is very micro in nature. And the way we've tailor-made it, it's not a product where you can say, can you increase it for me? Can you reduce it? Can you do this? It's already tailor-made the way it is. Because that's why you see the premiums are very low, Alice. The premiums are really low. And if we were to add any benefits or even take them to the other comprehensive cover, unless they are willing to now part with more money. So the premiums are low. So that is what is covered for those premiums. Yeah, unfortunately.
So I hope, Nedi, you are answered. We have Jared. Is it possible to unbound family members only without principal member who might be covered elsewhere?
You know,
Hello? We are not getting you, Brenda. Hello,
sorry
Brenda.
about that. Sorry. I was receiving a call and I'm hotspotting. Sorry. Can you hear me now?
Yeah, sure. You're okay.
You can hear me, yeah. Sorry, I'm hotspotting from my phone to the iPad. So when someone is calling, it kind of affects the network.
Yeah,
Sorry
sure.
about that. So the question was in regards to, just remind me.
Yani covering only the family members.
Oh, yes,
Out
sure.
the sure.
So basically, like I stated, you know, the reason why the principal is important is because this principal is the only person who is a member of Telepost, right? I'm assuming.
Yeah, sure.
So by virtue of this principal being a member, That's the only way the family can benefit. If the family comes by themselves, they're not members of Telepost. And unfortunately, Coop Care only helps members. That's why I said you can have two medical covers running. You can have where you're employed, but you can still have Coop Care for, let's say, backup. You see the way you can have a medical cover and maybe you have a big family, will it be sufficient? No. So you decide, let me take Coop Care as well, so that if we deplete this one, we can always have a fallback plan, basically. But the principal must be there because they're the members of the circle.
Okay, sure. I hope, Jared, you answered. Let's come to Hawa. He's talking about devoting the family.
Excuse me.
Yes,
Excuse.
Jared? Yes.
Yeah, partly under, assuming now one of the family members is also a member of Telepost Sacco.
It's sent.
Do I need to be there?
Actually, if your family is also a member, your other
yeah.
family can now take. If, let's say, for example, your family is a member, let's say your siblings, or maybe your husband and wife are both members of Telepost, they can both take because they are both principals by their own virtues. You know, you can be a principal the same way you can have a medical cover, you put your spouse. Your spouse is also working in a different organization. They have a medical cover, they've put you as spouse. It works the same way. So both of you can take. So if you feel like you already have another one, so your wife can take this one as the principal by being the member of the circle as well, and put you still as spouse. They don't have to leave you out because probably they're also riding on the other cover with you.
Thank you, Brenda.
Yeah.
I hope NT, you are covered. You are answered well.
Yeah, assuming now I have a son who is 22 years, who is in college. He's a member also of Telepost Sacco, but he's still under my care. How does that one work out?
Would you want them to have their own cover as well? Are they able to pay for
No,
themselves?
they are still under my care because they are students. You say any student, any person or a child who is 21 years.
To 25 years.
Yeah, I understand. They could be members, but they still can't afford. So they'll just be under the member because they can't afford. Yeah.
We can't get you, NT. You're good.
I'm saying, yeah,
Yes.
assuming my son is 22 years, who is still a student, and is depending on me, and also it happens that is also a member of Telepost Sacco. How does that one work out?
Yes, you know, they may be 22, they may be a member of the circle because they're above 18, because the circle usually allows anyone who is 18 and above to join, right? So they may be members, but the question is, can they afford to pay for themselves? If they can't, they'll still just be under you because it's not mandatory for all members to be on board. It's only for those who are able to afford. Does that answer the question?
Somehow, because you are saying only members are entitled. Anyway,
I'm saying, if you're keen, this is the catch here is, can your 22-year-old have the premium to pay for themselves? You've said no, yeah? But at the same time, you're saying, I mentioned between 21 to 25, they can join as long as they are still under care of the parents. So in this case, it is you to decide, are you placing them under you or are you allowing them to be by themselves by being members? Because above 18, you are allowed to take your own cover. You're an adult. But we only extend grace because we assume the child is still in school. Maybe they are not able to afford. But if they are able to afford, because some kids are start working even at 22, they can afford a cover, they take for themselves. We're only talking about a situation whereby this is your child, they are between 19 and 25, they're not able to afford. We just need a proof of them still being in school and they'll be under you. But if they can stand for themselves, there's also that option. But even if he is a member of the Telepost Sacco, they can still be your dependent. That doesn't stop them from being your dependent.
Sure.
So that does not allow me to opt out because one of them is a Telepost Sacco member.
No. Actually, we won't even know this other person is also a member. We will just look at you as the principal, them they're just your dependents. It doesn't matter if they're members or not.
Okay, thank you, Brenda.
You're
Thank you.
welcome.
Thank you so much, NT, for that question. And thank you, Brenda, for elaborating. We come to Hawa. He's talking about what if your family member is less than 6 people? I think that is.
Yeah, that's a question that I was waiting for because it usually comes up always.
Yeah, sure.
But this is the thing. You see the way this cover is, it's not that cover where you come and say, I'm this years old, I only want inpatient of this, outpatient of this, give me a quotation. No, this is a cover that has already been placed. Yeah. So this is what happens. Whether you have 6 kids or you have, whether you have 5 kids or you have 2, you will still pay the same premium. If it was 36,000, you will still pay the same premium. So if you find like you get a child in between cover, you find that child is now automatically covered. So people have always wondered, like, why would someone who has 2 kids pay the same as someone who has 5 kids? The only advantage is now the cover will be more sufficient. There'll be more quality in terms of usage because now you'll be a smaller family. You'll even enjoy the benefits more. That's literally the only advantage I would say. But in terms of premiums, it's the same. Whether you have 1 child, if it's M+1, M+2, M+3, up to M+6, same premium. So unless it's you alone, that's when the premium is different.
Okay, thank you. I hope how you answered. Let's go to Bob. Maybe Brenda, we can have the screen on charges. Let's have the page on charges on our screen so that those who are asking on charges, they can be
This one?
at it. Yeah, sure. So they can be looking at it even as we continue. So Bob is asking, are there advantages of being a member of Telepost over a non-member under this CIC insurance?
A benefit of being a member over being a non-member.
Yeah.
Basically, if you are not a member, you can't take Coop care.
Yeah, sure.
Basically, it's just that simple. As long as you're not a member of a society, you cannot access Coop care. It was only built for the cooperatives movement. Some people have always come and asked us, can I take for my parent? My parent is 65. Is your parent a member of the Sacco? No. So your parent can't have it.
Yeah.
So you have to be a member of a Sacco for you to enjoy the benefits. Yeah.
Because maybe if they had known the rest of the covers, how expensive they are, then they can be able to understand that this product is for cooperatives, and that's why it's very affordable to us.
Yes, sure.
Yeah. So I will also allow any other member who has a question, you can just unmute and speak. Or you raise your hand. Maybe Brenda, you can go through the charges once more, even
okay.
We had so many questions on this.
Yeah. So maybe just to recap this again.
Yeah.
You can see one side is all benefits, the other side is inpatient only. So for all benefits is the same way I showed you this. You see now option 1, the way it shows you all benefits. Yeah, it's just that now the premiums are not showing here, but this is where the premiums are. So for option 1, which is an inpatient of 100,000 and outpatient of 30,000, as a member you pay 7,500. M+6, that is member plus 6 dependents, you pay 26,700, and any extra child is 3,600 for option 1. For option 2, we have 200,000 inpatient, 40,000 outpatient. As a member, you only pay 8,500 per year. As a member plus 6 dependents or less, you pay 31,600, and any extra 4,100. These are yearly charges.
Sorry about that.
Oh, it's okay. Then option 3, which is the highest, is 300,000 inpatient, 50,000 outpatient. As a member, someone is trying to say something? Sorry.
I don't think so. Maybe it's from the background. You can continue.
Okay. Okay, so option 3, like I mentioned, inpatient 300,000, outpatient 50,000. Most people actually go for option 3. As a member, you can pay 9,500 if you are by yourself per year. So like the member who was asking if the 22-year-old can opt. If, let's say, for example, they feel like taking for their child by themselves, they can pay for them on their behalf. 9,500, they're by themselves. Their benefit is 300,000 and 50,000. You understand? So that one is even an advantage because it's cheaper if they pay for the child by themselves. Then for same option 3, 36,000 for member plus 6 dependents and 4,600 for any extra child. Like I mentioned, you can never take outpatient only in any insurance cover for medical, but you can always take inpatient only. Because, you know, inpatient, some people take inpatient only because they're like, I only want a cover that can help me when I'm admitted, because that's where maybe a lot of money is needed. So for inpatient only, 100,000, you can pay 2,500 per year as a member only, and a member plus 6 dependents, 7,300 per year, and 1,100 extra. And then for option 2, 200,000 for inpatient, 3,200 for member only, 10,800 for member plus 6 dependents, and 1,400 for any extra. And for option 3, 300,000 for inpatient, you can only pay 3,800 as a member per year, 12,700 member plus 6 dependents, and 1,700. So you realize that if you decide as a family, I'm only able to afford inpatient only, by all means, pay the inpatient only. So it's either you have two options. You pay for all benefits or you can only pay for inpatient. So Alice, I hope that comes out clear.
Yeah, sure. I think that one is so good now. Those who are asking, they're good. I don't see any hand raised. I feel like we are good. And I just want to tell our members that the last time that we had financial wellness training, we had a health speaker who was talking to us about how much health is very important to us. And that is why as a Sacco, we've realized if maybe you've retired and you know retirement comes from 55 years and below, you can still be able to benefit from medical covers. And also maybe if you are not covered at your workplace, and you can also take advantage of this. And the SAC always will be able to cater for you loans to be able to, maybe you can be able to pay pole pole, even as you get a medical, you're covered on your health.
Actually, Alice, that's the catch.
Yeah,
They
sure.
shouldn't worry about the premiums. As long as you come through the Sacco can pay
Yeah,
CIC. You can have an arrangement, insurance premium financing with the Sacco.
Sure, yeah.
Yeah.
Thank you so much, Brenda. I don't know. I saw our chairman was on board. I don't know if he'll...
Maybe Chair can say something before I leave.
Chairman, kindly say hi to us.
Thank you so much, Alice and Brenda.
Yeah.
And then their team on board. I think the expression is very, very clear. You've gotten very well. It's only that I don't know whether, let's say, for example, on the side of eligibility that you must be a member of a particular SAC, for example, or for this case, Telepost Sacco. Now, let's say I've decided I'm no longer an active member, but I still have my capital shares in that particular Sacco. Do I still qualify?
Yes, you can. As long as your member number is still there, you can qualify.
Okay.
Yes.
Okay. So I think maybe we request for this write-up to be shared and the people can be able to go through it again, because 1 hour is very short time to understand all the products there. But I'm sure you're going to share it for us to be able to digest or deep dive on on the write-ups, and then maybe can make our decisions on the way forward.
Sure, Chairman.
No problem. We'll share the
No.
same with. We'll make sure it reaches all members.
Okay.
Yeah.
Thank you. Thank you.
Thank you.
Thank you so much, Chairman, for that. Yeah, we really appreciate all the members who found their time to join in. I know the latecomers who joined later will be able to share it, even this training, on our YouTube page. So you'll be able to go there later and be able to listen. And also at the same time, even as we'll be able to share the write-up. So you'll not be left out. At the same time, callers will be able to explain to you in details. Will be also a contact people to CIC. So don't be afraid that you'll be able to contact CIC directly. You can contact us, then we reach out on your behalf, even as we connect you to them, so that you can be able to benefit. Thank you so much, Brenda, for your time. Despite of your challenges, you sacrificed to be here today. We really appreciate it so much. Thank you. Yeah,
Thank you for the invitation as well. Yeah.
I know CEO could want to be here, but because of unavoidable reasons, she's not here today. But she's here at heart with all of us. And thank you, Chairman, for representing the board. And I know we have other directors here, Director Respa, Director, our NT was here, and many others. We really appreciate you and all the members. So we'll keep on training you on important matters, not only for the Sacco, but we really want to support you in all angles. Thank you. Brenda, you have anything, Amma?
Oh yeah, mine is just to thank the members who've been able to join.
Yeah, sure.
Medical is one of those insurances that it's not just a want, it's a need. So everyone should have a cover, and you only know the importance of a medical cover when you have been in that situation or any family member, and it has depleted you. So it's very important, even as the members internalize on the same, let them just remember that medical is a necessity as an insurance. And CIC, we always are here on ground to support the cooperatives movement. And we are here to support you with our products, even by offering you the best services that we can. So they shouldn't worry about the services will be seamless. That's all I can say. And also just to encourage the Sacco to champion this to the members, make them understand it over and over, so that even by the time they are onboarding, they understand the product well. Yeah, so thank you so much, Alice, for the invitation. And I was happy to be here with you. Thank you.
Thank you so much. Mildred is asking, like, how long does it take for you to qualify? She's a late comer, we can't just leave her.
She can qualify immediately, but I think she can also go through the presentation and see the pre-existing conditions, waiting periods, and all that. So in case there's any further questions, Alice, always just call me. If members are asking, maybe they want to onboard and they have more questions, I'm always on call, so that I'm able to answer them. So no problem.
Thank you.
But maybe just tell her she'll get services immediately.
Your presentation to the contact numbers.
These ones only help you. These ones only help you once you're on board.
Oh, you are onboarded. Someone was
asking for your number. Onboarded.
But we'll be able to give them.
Yes, sure. No problem.
Thank you so much, Brenda. We really appreciate it. Have a good night.
Thank you too.
And to all our members, we really appreciate you. We really thank you. Have a good night.
Good night.
Yeah, good night.
Then number Brenda then.